Cool. Hi, everyone. Welcome. My name is Evan Elkin. I'm the Executive Director of Reclaiming Futures, an organization based at Portland State University in Portland, Oregon. And we are a public health organization that focuses on youth serving systems like school districts, child welfare systems, and juvenile justice systems around the country. And I'm here today to talk about a unique new screening and resource tool that we're calling My Kid's Voice. And you'll see the other logo at the bottom of our screen, Tickit Health. They are our partner in this project, and I'm joined by one of their project managers, Ashley Nguyen, who will talk about some of the technical side of this tool at the end of our presentation today. So let's get started. So what I'm going to do is give a little bit of an overview of this tool, some of the rationale for why we created it, some of the key elements of it, and then we'll walk through the tool itself. We'll link to the tool and go through the questions and show you what happens at the back end in terms of what kind of report is produced by the tool. And Ashley will walk us through some of the analytic capabilities and reporting capabilities that exist as one of the cool features of this tool. I'll touch on throughout some of the key elements of a successful implementation. It's a relatively new tool, but it's being piloted, and I could talk about some of the successes we've had so far and some of the ways that we can guarantee success by paying attention to some planning elements. So it's not a surprise, new information to most of you on this call, that young kids, particularly in the younger age groups, are experiencing some significant stressors and anxieties, being isolated at home, schooling at home, and prior to COVID, prior to the pandemic, mental health issues like anxiety and depression were known to be on the rise for kids 6 to 17, and that not a lot of studies have come out, but some of the national data that we're beginning to see now from the CDC and a recent study by the Annie Casey Foundation are indicating that as a result of the pandemic, that some of the various elements, the social isolation, the economic stressors on families, frequent loss and illness, challenges of schooling at home, racial inequities in both access to care and the elevated awareness of racial inequity and the trauma and re-traumatization that has resulted in have all been drivers of a spike in mental health problems for young people. Access to care is more difficult than ever. I think, depending on the community that you're in, clinics now are much more difficult to get to, and unemployment has led to loss of insurance access. So access to care is not what it was pre-pandemic. Even if you were, aware that you needed care, lots of folks in this, there's a lot of press about on the medical side of things that folks are not seeking medical care for mild to moderate issues because they're aware that resources are limited, or they don't want to publicly get out there and go to hospitals and clinics. So that is a factor as well. And because we work in school settings, we're aware that schools play an important public health role in communities. We sometimes talk about them as a bridge to public health resources. Parents rely on schools and school counselors to help them understand where resources are, or to clue them in about something that might be going on with their young person that they weren't aware of. And so the disconnection from school and the narrowing of that function has really been one of the issues that we're trying to address with this tool. So our goal with creating this tool, which you'll see in a moment, is to really strengthen and empower families to be able to access resources and make supportive connections in their communities on their own without necessarily needing a mediating entity like a school or a case manager or an intake worker. Although you'll see that that is something that we have built in, depending on what type of implementation a particular community is using with this tool. This can be a completely freestanding tool that delivers resources and ideas for support without a connection. But it is possible, as you'll see, for a parent to seek out a connection and indicate that they'd like to talk to somebody. So some key features to keep in mind while you're watching the demo is this tool is designed for younger kids, age 5 to 11. And This tool is part of a larger group of tools that were created by us in one instance, the Here to Help tool, and by Seattle Children's Research Institute and Tickit Health, a tool called Check Yourself. So we cover other populations from adolescent and adult populations. And the Check Yourself tool is a highly comprehensive screening tool for teens that's being used in lots of middle schools and high schools around the country. Another feature, so you'll be seeing a version of Check Yourself that was customized for a community in the state of Washington, the Tahoma, Washington School District. So what you'll see are resources and logos, et cetera, that are the result of the kind of customization that we would do for a community that licenses the tool, essentially purchases the tool. I want to highlight that the tool is, there's cost associated with adopting this tool for use in your school or in your community or at your workplace. It's not as expensive as you might think, and between the partnership between Tickit and Reclaiming Futures at our university where we're based, we seek to be really flexible in working with sites who are interested in getting a license to figure out a cost and a strategy that works best for them. So there'll be an opportunity at the end for you to see our contact information if you're interested in talking about licensing the tool you're about to see. Okay, so let's jump into a demonstration of the My Kids Voice tool. So what you're seeing here is a customized welcome screen created for the implementation that I had mentioned earlier, the Tahoma School District. And you can see they have their logo on there. We have the flexibility of adding imagery and to some degree tailoring this little intro message about what this tool is about. This is somewhat generic. It's important, I think, to talk about what the school is, but there's some, what the tool is, but there's some flexibility for each school to include other messaging at this point that they'd like to include on this opening screen. So after you click next, you see some information specific to the tool itself, and the first graphic image, you'll see a number of graphic images throughout the tool. And it explains, and again, as I mentioned earlier, this tool will be delivered to a caregiver's email address or text or some other way of getting it to them. And there's an opportunity in that email message also to do some explaining of what the tool is. We hope that the email is not the first time that a caregiver has heard about this and is reading it for the first time. And one of the implementation elements that we recommend and that we've done with our pilot school in Tahoma that did this customization that you're seeing is to do a little bit of an information campaign. They held an open Zoom kind of town meeting for families to ask questions and see a demonstration. So they're not seeing this for the first time. They're prepared for it. They understand it, and they've essentially opted in by the time they've gotten the link. But this screen also explains that the idea behind this is for you to address concerns and anxieties that your child may have or that you may have about your child. And these are the two key elements of this screening tool, is that it is both the parents' concerns and their assessment of how their kid is doing, and some answers directly from the young person, hence My Kid's Voice. And the process is designed for the parent and the young person to be sitting down together. And this is obviously particularly important and critical for younger kids who are not at a reading level to handle the material, the reading material on the screen. But really the idea behind this is not a screening tool for even kids up to age 11 to sit on their own and complete. Part of the idea is for parents to be sitting by their child's side and to hear the answers and to experience the questions at the same time and watch their kids kind of deal with the questions. This screen also lets parents know that there will be resources at the end of the process. They will see them either on screen, they can receive them by email, and that there are two kinds of resources. There are resources that will help you as a parent, caregiver, help your child, mostly around how might I talk to my kid about COVID or loss or stressors or how they feel. So how do I talk to my kid? And also the second type of resource are community-based resources that a parent might connect with directly in their own communities. And you'll see later that those resources are visually divided on the screen when they're delivered, and the parent can pick and choose which they find most useful. Instructional screen for the parent that the first questions are for you as a caregiver and the next questions are for the child. So it may be that you have the parent waiting and the kid waiting, off in the wings somewhere, and the parent does these questions and then invites the kid over, or there's really no harm in the young person sitting there together. So this screen is really about, do you want to get started? A number of the tools that we've created in partnership with Tickit Health offer this option of just accessing the resources right away. If a situation feels urgent or a parent didn't realize they were about to do a questionnaire, or they're just more eager to see resources than answer the questions, we like to give them an option to opt out right now and just see the resources. You can see this button here in the center. And if you want to continue, we have the Let's Get Started button. First opportunity for information is to give the child's age. Let's say this child is 8 years old. Since we are still at a point with the pandemic that some kids are schooling at home remotely, some kids are in person at school, or some are doing a hybrid. So for data sorting later, and also some customization of the kinds of questions and ways of thinking about and framing the questions, we give the parent the opportunity to talk about how their child is schooling at the moment. So let's say this is a hybrid of partly in school and partly at home. So this is the first of only 2 assessment questions. This is not a deep level diagnostic assessment. You're not asking the parent to comment on a number of symptoms. This is really about elevating the consciousness of the parent about their own concern about their child. This may be the first time anyone asked them, are you concerned? They may have been harboring some concern about how their kid is doing behaviorally or emotionally. So this, it's meant to be a conversation starter and a way of elevating the parent's own awareness of how they think their kid is doing. So let's say that this parent in this demonstration is very concerned about how their child is doing. And we've kept it in the generic, and the second question gets a little more specific about what we mean. And the STEM is, my child has been showing signs of distress, anxiety, or sadness. And for those of you mental health professionals watching this, you know that anxiety and sadness might typically in a screening tool be asked about as separate dimensions, separate questions. This is really just about the parent to be thinking, is there something going on generally in the category of emotional distress, whether it's anxiety or sadness? And this parent again is concerned and will say yes. This is the transition where the parent invites the child, or where it signals that the next questions are for the child to answer those questions. A kid who is a reader and adept at reading can read and answer the questions on their own, and obviously the younger kids, or if the parent just feels like they want to read aloud with the kid, they can ask the questions. And this is one of the unique features of the tool that's signaled here to the parent, is that at the conclusion of the questions, there are some suggestions for supportive feedback that a parent can give in the moment after seeing the responses. And really the parent is guided to really listen to the responses so that they're not just reading the supportive feedback that you'll see on the screen at the end or after the child answers the questions, but using that as just a jumping off point if the kid has indicated some distress, so that the parent is able to give empathic feedback right away, and that can become a conversation starter for them that might move them toward getting them some extra support. First question for the kid: today I feel. And you see this is very image and icon driven. For a young non-reader, the eye will be drawn to the images initially. So these are non-mutually exclusive. A kid can feel excited but also worried and sad. Technically, you could feel happy and sad. In mixed, you could be missing seeing your friends. So here are just some of the general responses that this kid could respond. The next question is about school and whether you're in school. This is sort of a generic question. Even if you're back in school, when I think about being back in school or going back to school, I feel some kids may feel safe. Other kids may feel worried about getting sick. I miss being at home. I was at home for a few months and now I miss being at home. I need more information about how to stay safe. I want to learn how to stay safe. So here are some sample responses to this one. And when I think about being at home, learning at home instead of at school, I miss my friends, but I feel safe. That's one possible response set that you might see. And this is the first in a series of feedback screens, the supportive feedback that I mentioned earlier. And again, this is not meant to be read rotely by the parent, but could be. It's written in conversational language. It's normal to have lots of different feelings. If you're feeling sad or scared, it's important to talk with your family. The idea behind this first one is really to validate the young person for giving an honest response and talking about how they're feeling. It gets more specific, and this screen is derived from the mix of answers that the young person gave. So you answered that today you feel a mix of things. And thanks for letting me know how you're doing. It's natural to have lots of different feelings. Again, it's a validation and an empathic response to the answers that the kid actually gave. And then this is the similar kind of a supportive response specific to the question about going back to school. And each screen generates a supportive response set like this for the parent to use. And I don't think this takes a high degree of training for the parent, but as I mentioned, you probably don't want parents to see this for the first time necessarily when they're going through it. There should be some discussion so they know to expect. There will be a series of screens that will help you give a validating and supportive response at the conclusion of your child's questions. That is the sum total of the screening and supportive response portion of the tool, and begins the resource portion of the tool, where the parent is asked, how would you like to view resources? Of course, there's an option to say, I don't want to see any resources. I'd like them emailed to me, or they also have an opportunity to see them right away on the screen. And I'll just for demonstration purposes, I'll elect both of these options so you can see what they look like on the screen. There are 4 kinds of resources that we offer. And again, this is one of those things that could be customizable about this tool. There could be a category of resource that's specific to your community or to a change in the climate in your community that you'd like to include here, and we can talk about that. We think these are generic enough categories that any additional resources that you'd like to include could be put under these umbrellas. And as I mentioned earlier in the presentation, some of these resources are about how might I talk to my kid about these topics, about how do I explain racial equity to my kid? How do I talk to them about the fact that we lost somebody? We recently did an implementation of one of our screening tools in a school district in Louisiana, and found out that 16% of kids in that school had lost a close family member due to COVID. And that came as a great surprise to the school district. They knew this was happening, but seeing the statistic was quite jarring and led to some conversation about, what kind of supportive resources do we need in the school? So part of the resources here help the parent directly to come up with ideas for how to talk to their kid. And then the other category of resources, as I mentioned, are things in the community. And that is a localized and customized aspect of this tool. Those resources have to be located and included by the person, by the community using this screening tool, and Tickit Health enters those into the back end of the tool, so that actual local available resources appear. So let's stick to health and safety, just for brevity. So here are the two categories. As you can see on top is the how do you talk to your child about health and safety. We have 3 links here. If we can click on one right now without leaving the, so for example.
This episode is made possible by the Corporation for Public Broadcasting.
So here we have.
It's Daniel Tiger's neighborhood, a land of make-believe. Won't you?
I'll just show it briefly. This is a video for younger children to talk about health and safety related to COVID that was shot by PBS Kids. So one of the links in the tool is a direct link to that. You parent could look at it and decide this is something I'd like to have my kids sit down and watch. Other links are more informational and take you to websites and articles about good strategies for supporting and talking with your kid. And then there are a set of community-based resources that the example here is the Tahoma School District that they came up with, that they would like, that they wanted to have in the tool for their family members to see. So we'll zip forward here. After you've selected one, it gives you an opportunity to select others. Let's just click out now and go to the next screen. And this is the question, the Tahoma implementation, they decided they would like to offer the parents an option of having a support person from the school reach out to them, either to help them navigate resources, talk about their young person. It's not specific to why, just an opportunity. If a parent says, these resources are great, I'd really like to talk to somebody. In this instance, the support person was determined to be part of a group at the Tahoma School District. So let's say yes to that. And the next screen gives you an opportunity to tell them how you'd like to be contacted, by email or phone. Let's say email is the preferred method, and you have to enter your contact information. The responses, as you can see, are being now submitted to Tickit Health, to the platform there. And you'll see, now I'm going to turn it over to Ashley Nguyen to show you what happens to those responses and how they look on the back end in terms of a report.
Okay, so as Evan mentioned, I'm Ashley Nguyen, and I'm a project manager at Tickit Health, where we do, we're the software platform that hosts the kids tool, as well as do the customization and kind of that support and ability to look at the information in the back end. So as you can see here, right up at the reports page, I have Evan's sample submission. And what's really great is that you can actually filter the flags from ascending to descending order. So you can see that Evan's submission is actually the top because there's 1 red flag and 3 yellow flags. And so flagging is also a great way to triage and to kind of see who you should contact first in terms of the parent or the family. So let's click into Evan's sample report that he just completed. Again, right up at the top, you can see the answers that he flagged yellow for, as well as the red flag, which is saying yes to having a support person reach out to him. And again, this is a very simple question answer kind of report layout. And then at the bottom is where the providers or you at the school district can reach out to the parent with this email and name. So a really powerful aspect of the tool is the analytics, which is where you can see the aggregate data in kind of a population health format. So let me take a look at today's data for the kid tool, my kid's voice. Okay, here we go. So as you can see, all the responses are in a bar chart format, and you can see that, again, those yellow and red flags come up right up at the first screen. So you can see that 1 response out of 3 said they're very concerned about how they think their child was doing, as well as you can see 2 responses here would like a support person to reach out to them. So you can actually click right onto the bar chart to see those specific reports, and again, check out the email or the contact information in order to respond to those parents as soon as possible. And
Great. So I'll just add a couple things. Thank you, Ashley. I think, the analytics are, as you mentioned, a really powerful aspect of what this tool offers. And when you think about the option of not having someone contact you, it also allows you to take a look at how the population is just generally feeling and how they're responding to the tool, even if the intent is not necessarily, as you mentioned, to triage and contact folks. You can take a look at your population and understand, wow, we're seeing a lot of distress. We've got a parent community that's showing a high degree of concern about their young people. You can also look at how questions relate to each other. So parents who are concerned, but kids are not reporting distress, or parents are concerned, and that does line up, pretty closely with how kids are responding. So there's a lot of interesting ways of kind of digging into the data, and I think, depending on the implementation you have, and there are not a lot of questions here that raise a serious red flag that you might have some urgent concern. Really, the only red flag in this tool is that someone says they would really like to speak to someone. So it's I think there are options for making the entire tool anonymous and not having an option for parents to contact. So there's lots of different ways that this can be implemented. So thanks for that demo, Ashley. And I'm just gonna cut back to our contact information so that you can get in touch with us if you want. So I'm sure there are a lot of questions generated by the presentation and by the demonstration, and we're eager to talk to folks. This is my email address here at the top, and I'm just gonna make it a little bigger here. Current slide, there we go. So feel free to reach out, and we can set up another demonstration, interacting with your team directly, or a phone call, whatever works for you. We look forward to talking to you.